X-ray. Hi. You need a C-arm in room 5? All right, we'll be right there. Hi, you caught me at a good time. My name is Berremy. I'm gonna teach you how to use a C-arm in the OR. Let's go. All right, the first step, make sure you're properly dressed for the OR. I'm gonna put a mask on. There we go. A bouffant. Nice and neat. Perfect. And now we're going to talk about radiation protection. You want to protect your eyes. Get those fluoro goggles on. All right. Thyroid shield. And of course, your lead apron. Make sure you're properly fitted so that it's not uncomfortable, because you're going to be in the OR for quite some time. All right, let's go to the machines. All right, now we're at the C-arm. You want to make sure everything's locked before you push it in. All right, and now that I've seen everything's locked, I'm going to unlock it, and we're going to bring it right into the room. Hello, X-rays here.
Hi, how are you?
Do you mind if I just put the C-arm right here and we can have it draped?
Yeah, that's actually perfect. Let me know whenever you're ready.
Okay, I'm gonna just plug my equipment in and we'll have it draped. Thank you. All right, now that we have the equipment in the room, we're gonna go ahead and plug everything together. First, we have the computer, which we want to plug into the C-arm unit. All right, gonna go over here, match the red dots, make sure it's plugged right in. Computer, C-arm. Now that the C-arm is plugged in, we're going to plug the computer to the wall. You want to make sure your lines are out of the way. Okay. Now we have computer plugged into the C-arm, computer plugged into the wall. We can turn on the unit. Okay, now that your equipment is ready, we're going to go ahead and have it draped. Hi ma'am, would you please drape our C-arm unit?
Sure.
Now that your equipment's set up, let's go ahead and input the patient information. And now we're going to verify that patient information. Hi miss, is this patient Alan Young, birthday November 29th, 1987, here for a laminectomy?
Yes.
Do you mind if I get a sticker?
Yeah.
Oh, thank you. We have the correct patient on the system.
All right, now we're gonna do a timeout. So the patient is Alan Young, birthday 11/29/1987, here for a laminectomy procedure of L4, L5, anterior approach. Does everybody agree?
Agree.
Okay.
Come in with X-ray, please.
Yes, doctor. Before you come in with the C-arm, you want to make sure underneath there's no lines or catheters that'll impede your C-arm. So we're pretty good over here. You also want to make sure what position the patient is oriented. Ma'am, is the patient prone or supine?
Supine.
Supine, thank you. Coming in with the C-arm. You want to make sure to come in nice and slow. And if you have somebody that is readily available, they'll help you with the sterile field. Miss, do you mind lifting up those drapes a little bit?
Not at all.
Thank you. We're going to come in nice and slow so that we don't break the sterile field. Always watch for instruments that are sticking out of the patient.
You're good.
All right. And before we shoot the x-ray, we want to make sure that our monitor, again, is perfectly in line with the doctor. How's that?
A little to the left, please.
All right.
There's good, thank you.
There you go. And we want the patient as close to the eye as possible. But because we've reached the highest point, we're going to ask the anesthesiologist to lift the table up. Miss, do you mind raising the table a little bit?
Will do.
That's good. Thank you. And before we shoot, we want to make sure everybody has lead. Survey the entire scene. Excuse me, ma'am, we're about to shoot an x-ray. Do you have lead?
I don't. Shoot, I'll be right back.
Thank you.
Thank you.
How's that look, doctor?
Come up north a little bit.
Yes, sir.
There's good. Lock your base there.
Locking my base.
Take a shot there.
X-ray.
In and out towards me, 1 inch.
Yes, doc. Right there.
There's good. Shot there.
X-ray. Beep.
Save and swap that.
Saving. Swap.
Alrighty, come all the way down to the foot.
Yes, doctor.
Thank you. Coming for x-ray, please.
Yes, doctor. How's that?
A little bit more north. That looks good.
All right.
Lock your base there.
Locking the base.
X-ray.
X-ray.
Come in for a true lateral, please.
Yes, doc.
Oh, hold on there.
Sorry,
you know what a
doc.
lateral is? You know
I
what
do.
you're doing?
Yes, doc.
Give me another tech, please.
I'm sorry, doctor. Always know which levers you're operating.
Alrighty, can you give me a true lateral, please?
Sure.
Oh, can you hold on 1 second?
Sure.
Thank you.
We're okay?
Mm-hmm.
Alrighty, shot there.
X-ray?
Can you raise the table, please?
Yes.
Alrighty, shot there.
X-ray?
Save that.
Saved?
Can you pull all the way out, please?
Sure. Unlocking the base, and I'll pull straight out.
Faster, please.
Sorry, doctor.
All done with the C-arm, if you're ready to turn it off, you turn it off in the reverse order you set it up in. So before you turn off the monitor, you want to make sure that your tower is all the way down, because if you turn it off and it's still partially up, there's no way to get it out without rebooting the entire system. So you would start with this, turn that off there, then you would unplug the power supply from the wall, unplug that, and lastly, you would unplug the C-arm from the monitor. And then you're good to go.
So here's a good way of cleaning the C-arm before you put it away. Always make sure you're cleaning the cord as well as the monitor and the C-arm and all the buttons.
So it's important when you're setting up the C-arm to make sure your orientation is correct. So on most C-arms, there will be a smiley face on one side. That indicates that you're in the correct orientation if the patient is facing up and head is on the side of the C-arm. If not, then you have these orientation buttons. This one switches right-left, and this one switches head-foot. So when you're first starting out, it is helpful to mark for specific positions. So if the doctor tells me to come in, I know that I want to push in for the first shot to here, and then I've also marked the floor as well. So I'll push into that. And then I'm confident I have the same exact shot once I pull back in. So some other buttons that you'll use when setting up are regarding your technique. So typically you start in auto and low dose. If you have a very large patient or you're doing a spine case, the doctor might ask you to go into mag mode. And here are your options here. On this machine, you have 2 options for mag mode. It's important when you're done taking images once you're going back in, to retake images, ask them if they still want mag mode, or just remind them throughout the exam. So for your first shot, when you have it on auto technique, the ABC needs to come into play. So it's really important for the first exposure to do a 2 to 3 second hold. And what that does is it evens out the KV and the mass for optimum exposure. So it'll come up and down for the technique until you get exactly what you're looking for. And you only need to do that on the first shot, and that's true for the first shot of the AP or first shot of a lateral position. During the exam, the doctor might ask you to save and swap the images. It's really important to keep in mind that that's right by the emergency off button, so be very careful when you're using any of these buttons right here. It will delay an exam, keeping the patient under anesthesia for longer. So for extremity work, you might have your C-arm positioned in an awkward manner. So if the doctor wants you to come in more distal on the wrist here, what you'd want to do is align your wheels parallel to the part that you're x-raying. So I will turn in until it's parallel, then I'm confident I'll track on the arm when I'm going distal.